So today we'll start with space management. Okay, so that includes space maintainer and management of space, which has been created due to the exfoliation or extraction of primary tooth before its exfoliation time. Okay, that is space maintainer. Just a second. So, are you able to see the screen?
Yes, sir.
We'll start with space management. Just a minute. Just a minute. जाधव एक मिनिट यार त्या हे 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 आलं नाही पाहिजे हे कमी करा स्टुडंटचं जे दिसते का मिळतं मला हां चालेल बेटर आहे कारण ते दिसतच नाही आहे हॅलो So, in this topic, what are the contents of this topic? Terminologies and definition, then objectives, then the space closure following premature loss of teeth, effects of premature loss of deciduous molars on their successors, probable sequelae to premature loss of individual teeth, indications and contraindications of different space maintenance, what are the prerequisites for the same, consideration for before giving any space maintainer and the classification of space maintainers. First, the, how one can define space maintainer. Boucher's clinical dental terminology for this. Space maintainer is a fixed, maybe a removable appliance designed to preserve the space. It is basically designed to preserve the space created by the premature loss of a tooth. That is the definition given by Boucher's. Then he also termed what do you mean by fixed space maintainer? It is a space maintainer that cannot be removed by the patient. That is not intended to be removed by the patient. That is fixed space maintainer. Removable space maintainer is a space maintainer designed for easy removal, for cleansing, and for adjustment. So the removable space maintainer is designed in such a way that it can be easily removed for cleansing or adjustment by the patient. That is removable space maintainer. The last part is space regainer. Space regainer is a fixed or removable appliance capable of moving a displaced permanent tooth into its proper position in the dental arch. So the space which has been lost due to not giving treatment for the loss of deciduous tooth. The space may be lost due to the nasal migration of or distal migration of the adjacent teeth of the space. In that case, you can give space regainer. First, you regain the space, and after that, you have to maintain. That is space regainer. There are different types of space regainers are there. They can be removable, then fixed, or semi-fixed. Okay, we'll see it in detail later. Now, what are the objectives of space maintenance? What are the objectives of space maintainer? The best space maintainer is the tooth itself. A healthy, sound tooth with proper major distal diameter. Okay. That is the best space maintenance. What are the objectives of space maintenance? First is preservation of private spaces, preservation of the integrity of the dental arches, preservation of normal occlusal planes, And last important thing is it's aid in the aesthetics and the phonetics. Okay. So these are the objectives. First is preservation of private spaces. You must be knowing what we mean by private spaces. In the preservation of the integrity of the dental arches, preservation of normal occlusal plane, and it also helps in the aesthetics and phonetics. Okay. What are the different considerations before giving any space maintenance? So, what are the factors that will decide if you want to give space maintenance or not? So, there are different factors to be considered before giving it. First is time elapsed since its loss. The, according to some researchers, if you give space maintenance as early as possible after exfoliation or extraction, there will be minimal space loss. So that is most important. And then the second factor is dental age. There are different ages of an individual. First is chronological age, that is from birth till you present today. That is the chronological age. Then there must be any mental age. Mental age can be computed or can be recorded by asking different questionnaires to certain individual of certain age that is specified for that age group. That is mental age. And the dental age, you can determine dental age by knowing the chronology of the last erupted tooth in the oral cavity. If, for example, if the last erupted tooth into the oral cavity is permanent first premolar, that is not permanent, that is first premolar in lower arch, if that erupts at the age of 9 to 10 years of age. So the patient's age is, dental age is 9 to 10 years of age. Maybe patient's chronological age may be 11 to 12 years old, or 12 years old also, but the patient's dental age is 9 to 10 years of age. So that is the dental age. Then the amount of bone covering over that tooth present. So this amount of bone covering you can determine by taking a good IOP X-ray. You can measure over the bone height over that erupting tooth. That is erupting tooth's crypt. You can see the you can measure it in millimeters. Okay. And after about it, you can decide the how much time it will take to erupt into the oral cavity. That is amount of bone covering over that particular tooth. And the eruption of neighboring teeth, delayed or a deviate eruption, and the congenital absence. These factors to be considered before giving any specimen. Yeah, these are important things. For this, there may be question in your final year exam, theory exam. That is, what are the factors to be considered before giving any specimen? Okay. Next, according to McDonald and MD, McDonald is the name of author of Pediatric Dentistry book, that is McDonald MD. According to him, the maximum space closure or space loss occurs in first 6 months. Okay. And the closure can occur in days. If you delay in giving space maintenance for 8 days or something like 15 days or something, 30 days or something like that, and then you can see some space closure in those days. So the space closure can occur in days. So the time elapsed since loss, that is most important. And then you will decide which type of space maintenance or space regainer you can give. If the time elapsed is more, then you can think of giving space regainer. So you have to gain that lost space. And the fabricate appliance before extraction. This is the ideal methodology for giving any space maintenance. You can take impression with that tooth to be extracted, and then pour the cast. You can remove that extracted tooth in the cast, then fabricate space maintainer appliance. And immediately after doing extraction, you can, you can give the space maintainer after 1 hour or something, 1 hour after extraction. It is immediate. Uh, you can give the space maintainer. That is the ideal guidelines for giving any space maintainer. These are factors. Then the dental age, chronological age is not important. Teeth erupt after three-fourths of root development. So you have to see it in the X-ray. According to Knowles, there are different stages of tooth development. And that is given by Knowles. Knowles stages of tooth development. And so you can read all these things. Chart is beautiful. Knowles stages of tooth development. That is the dental age. Second part is then the amount of bone. If bone destroyed, prediction based on root development not reliable. That is most important. You can see in on any IOP X-ray due to the periapical infection, the bone has been destroyed and there is no bone at all over that erupting subcutaneous tooth, and you can see that there is no three-fourths of root development. In that case, if bone destroyed, a prediction based on root development is not reliable. So tooth can be erupt early also. So that things should be taken consideration. So that for that you require a good IOP X-ray before planning or giving any specimen. The, use the space maintainer. According to some researchers, for every 1 mm of uh, distance on IOP X-ray, the tooth will take another 4 to 5 months to erupt into the oral cavity. So, if for example, if on a particular subcutaneous tooth, you can see 4 to 5 mm of bone height, then it will take another 16 to 20 minutes for that particular tooth to erupt into the oral cavity. That is also important. Amount of bone, the eruption of neighboring teeth. Uh, Active eruption creates increased space loss. For example, extraction of second primary molar during eruption of first permanent molar. So, first permanent molar erupts at the age of 6 years of age, and unfortunately, for any reason, you have to extract that second primary molar, that is 7.5 or 8.5, and you have extracted that tooth, particular tooth. But the subcutaneous will be erupt at the subcutaneous will be erupt at the age of 11 to 12 years of age. So if you're not planning of giving any space maintenance, then that permanent first molar will erupt at the place of second primary molar. So that is also important. The eruption of neighboring tooth at the time of extraction, or at the time of giving any space maintenance. And the next is altered eruption path of permanent tooth. Example, distal eruption of mandibular second premolar. So if particular succeeding tooth, if they change their path of eruption, then there will be no exfoliation of that particular primary tooth. So there won't be any root eruption. There won't be any exfoliation of that particular tooth. In that case, you can, after taking oral pantomogram, that is OPG X-ray, that is big one X-ray, orthopantomogram. If you take orthopantomogram, OPG X-ray, and you can see that the erupting tooth, that is mandibular second premolar, has changed its path of eruption, somewhat somewhere distally. So in that case, you can do extraction of second primary molar. You can insert a space maintainer, and allow that particular second primary molar to erupt into the at at his exact place. So that is the altered eruption path of permanent tooth. The congenital abscess may alter eruption path of other teeth, that is the space. If some teeth are absent, make the other tooth to erupt in that particular place. So you can do orthodontic corrections, or you can do restorative correction by giving fixed partial dentures. These factors should be considered. Remember these factors. First one is time elapsed since loss. Second one is dental age. Third one is the amount of bone recovery. Fourth one is eruption of neighboring teeth. Fifth one is delayed or deviant eruption. And the sixth one is congenital absence. These factors has to be considered before giving any space maintenance. Remember all these factors. We move on to the next thing. Now, what are the prerequisites for a space maintenance? What are the good qualities in a space maintenance? These are the ideal prerequisites for space maintenance. First one, it should maintain the mesogistal dimension. That is most important. It should maintain that space, particular space of that particular tooth. Hello? Hello? Who has raised hands? Someone has raised hand. If somebody wants to ask me some question.
No, sir.
I have seen on screen that someone has raised hand for some team. That's why I asked. Okay. Prerequisites for space maintenance. First is to maintain the mesogistal dimension. That is there. Then space maintenance should be functional. It should be simple and strong. That is the design of space maintenance should be simple and strong. No interference with the normal occlusion. It should not endanger the remaining teeth by imposing excessive stresses on them. It should not interfere with the erupting teeth. It should maintain individual functional movements of teeth. It should not interfere with vertical eruption of adjacent teeth. Should have simple design, easily adjustable. It should not restrict normal growth and development process. It should not interfere with mastication, speech, deglutition. It should be easily cleansable, durable and corrosion resistant, reasonable in cost, and universally application. These are the all ideal properties of a space. So, the last sentence is no space maintainer will fulfill all these requirements except a sound and healthy primary tooth with good proximal contact. So that is the best space maintainer is a healthy, caries-free primary tooth with good proximal contacts. Okay. Uh, this is classification of space maintainers. It's given by all three big people. That is first is Hitchcock. That is according to Hitchcock, it may be removable or fixed or semi-fixed. It can be with bands or without bands. can be functional or non-functional. It can be active or passive. Certain combinations of that. So you can classify any space maintainer according to this classification. It may be removable, fixed, semi-fixed, with bands or without bands, functional or non-functional. If you incorporate some acrylic teeth in that space maintainer, it will become functional space maintainer. So whether it is a functional space maintainer which maintains the function or non-functional, active or passive. If you have inserted some active coil or something spring or some thing which makes that space maintainer active, then you can call it as the active space. Or, although it will be a passive space for certain combinations of the above. So one can classify space maintainer according to this classification. I think last 2 minutes are there. We will finish this. According to Raymond C. Thoreau, removable, complete arch, lingual arch, external anchorage, or individual tooth. So this is classification. Who is this Pawan Jadhav? Hello? Who is this Pawan Jadhav who has raised hand?
Sir, mistake.
Huh? What happened?
Sorry, sir, mistake.
By mistake you have raised hands.
Yes.
You are listening to this lecture or not?
Yes, sir.
You have invariably raised your hand. I can see on my screen who has raised hand, so that's why I call. Okay, no problem.
Yes, sorry.
So the second classification is given by Raymond C. Thoreau, and the third classification is given by Hendrik Sen. So in next lecture we will see all this classification in detail. Okay. Till then, see you people. See you in the next lecture.
Yes, sir.
Thank you,
Okay.
sir.
Yes, sir.
Okay. Done. जाधव झालं दाखवतो ना
टाइम का
टाइम लेस देन 1 मिनिट म्हटलं ना ते
मॅच चालू आहे
एकदा दाखव ना लेस देन 1 मिनिट ठीक आहे रेकॉर्ड झालं का ते